Aren't you playing the poster, Ganesh? It's not yet 6.
We can start when we are live.
Yeah, but it's not yet 6. Can you please keep the poster on for another minute or so? Okay, Ganesh, that's...
Stop sharing.
Yes. A very good evening and a warm welcome to you all. I am Jaya Jairam, the moderator for this evening. Having dealt with CKD, I know how important balancing the nutrients are, and that can pose a big challenge. On this occasion of World Kidney Day, MOHAN Foundation, in partnership with Nephroplus, is delighted to bring you a discussion on how to detect nutritional deficiencies through a physical examination and what are the signs to watch out for. Today's topic is aligned with this year's theme of World Kidney Day, bridging the knowledge gap towards better kidney care. This topic brings to light a new and a powerful toolbox in the hands of dietitians to assess the nutritional needs of the patients. This is called as NFPE, that is Nutrition Focused Physical Examination. So let us begin by understanding how it works and how can patients play an active role in better kidney care. It gives me great pleasure to welcome our speakers for the day. This is Pooja Lakhani. Pooja is an MSc in Food and Nutrition. She's a renal dietitian. She's a registered dietitian, formal clinical dietitian at ICU and Organ Transplant Unit in Apollo Hospital, Navi Mumbai. Member Secretary of Institutional Ethics Committee in Biomedical and Health Research at Apollo Hospitals, Navi Mumbai. Basically, she's the right person to share a lot of information on all of this. She's the expert over here. And I'd like to welcome my good friend and co-founder of Nephroplus, Mr. Kamal Shah. Kamal has been on dialysis since July 1997. Diagnosed with atypical hemolytic uremic syndrome in July 1997, he was on hemodialysis for a year and a half before undergoing an unsuccessful renal transplant. His mother had donated her kidney. Kamal was then on peritoneal dialysis for 6 years, and he was caught in the tsunami of December 2004 while holidaying in Mahabalipuram with some of his friends. A series of exit site, tunnel, and peritoneal cavity infections later, he had to give up PD. Kamal then switched to daily nocturnal home dialysis. He's currently on this modality. He did his chemical engineering from Osmania University, and now he's the co-founder of Nephroplus. He strongly believes that being diagnosed with kidney disease is not the end of life. Rather, it's beginning of a new life, albeit a slightly different life. A warm welcome to you both, Pooja and Kamal.
Yeah. Thank you.
So my first question is to Pooja. What is the meaning of NFPE? What does it mean? What is the meaning of nutrition-focused physical examination? And what is its significance with relation to end-stage renal failure? Over to you, Pooja.
So, good evening. I'm really delighted to be talking to people who deal with a disease day in, day out and lead a life which would be inspiring to many of us. I'll just share my screen so that the message goes very clearly to all of us. Is my screen visible? Can I get a heads up?
Yes.
So before we begin, let us first understand the burden of malnutrition. When we talk about nutrition, there's so much being discussed these days. What does it really mean? Why do we talk about it so much? Why is it really important to address malnutrition? I'm just sharing one article. There's a whole ocean of articles and researches that are being conducted to estimate the burden of malnutrition. This is a 2021 study. What they have done is they have included a whole lot of studies globally. All over the world, whatever studies were published and showed prevalence of malnutrition have been included in this. And such studies are called as systematic reviews or meta-analysis. What is, I would say, what really strikes in the results that have been published is that across the world, they included 61 studies which were eligible for the kind of studies they were selecting. And it was found that globally, 42.7% patients who are suffering from chronic kidney disease have malnutrition, which is a fairly large number. So if you, in this particular study, the number of patients that were included was somewhere around 21,000. So out of 21,000 patients, 42.7% are malnourished. What is even more striking is the highest prevalence was in India, 56.7%. So when you compare among developing countries, India has the highest prevalence of malnutrition in chronic kidney disease, which is more than 50%, except a couple of countries like Mexico and Jordan, where the rates were higher. But when you compare the medical facilities and socioeconomic statuses, India doesn't fall in the same bracket. So we have the highest prevalence of malnutrition when it comes to chronic kidney disease. Now, what happens when you have malnutrition? With malnutrition, you may have prolonged hospitalization. If at all you get into a state of disease where you need hospitalization, it may get prolonged. There's increased risk for surgical, post-surgical complications. There's poor wound healing. There's a whole lot of complications that we talk about. There is also, most importantly, there's increased mortality risk, which means with chronic kidney disease, if you happen to get another disease and you have underlying malnutrition, there is a higher risk of death, which may happen ultimately. Are we really ignoring this important part? Maybe. Let us take a look at the 20th century approach. Now, if we look at this picture, there is a group of people who are trying to probably, gone for sailing or river rafting. They're looking at something. But the flip side of it, they're ignoring the shark. They're ignoring the bigger problem. So what is happening in terms of the traditional nutritional practices is also somewhat the same. We keep looking at a lot of parameters, especially with end-stage renal disease like dry body weight. We calculate BMI using dry body weight. We look at a lot of other parameters, the lab data, albumin, pre-albumin. We look at electrolytes and stuff. We take down the nutritional intake. But whatever these tools are, all these tools at first place have not been sort of analyzed for Indian population. This has been created, analyzed, validated in the Western population. So, for example, let's talk about BMI. हमारे पास BMI के cutoffs हैं, but originally वो cutoffs जब publish हुए थे, those were published based on Western population. And recently they have been revised for Indian population. We don't know if Indian population really is being assessed correctly or not. All these is an objective data, which is based on a population from some other part of the world. Now, what is nutrition-focused physical exam and how is it different? It's different because nutrition-focused physical examination does not have any cutoff. It does not tell you, it does not give you numbers like so and so range, 20 से 25 होना चाहिए, 25 से 30 होना चाहिए, ऐसा कोई range नहीं है. The dietitian is going to look at you individually. The dietitian is going to examine you. For example, if you go to a doctor, the doctor asks you to breathe and show, and then they would put their stethoscope on your chest and see if your breathing is fine, or they would take an individual exam on you. This is similar. The dietitian would look at certain parts of your body, certain sites in your body, and then decide what is the status of your malnutrition. So this is individual. This is not something which, is can be sort of similar between you and any other individual. To keep it simply, there are 6 things which a dietitian might do under NFPE. They would check for subcutaneous fat loss. They would check for muscle loss individually at you. Signs which show that you may have micronutrient deficiencies, where they would examine your hair, eyes, mouth, skin, fingernails, fluid accumulation statuses, and functional status. Today in this session, because this is slightly technical and it may not be easy to take in so much information in one go, we will discuss about sites where you can individually at least realize that you have subcutaneous fat loss and muscle mass loss.
Thanks, Pooja. Over to Kamal. Kamal, I have a question for you. So, could you please share some common experiences of those who are on dialysis relating to nutritional deficiencies?
Yeah. So thanks, Jaya, and thanks for having me here.
Sorry, Pooja, can you stop sharing, please, so that it can be focused? No problem. Yeah. Sorry, Kamal, continue, please.
No worries. So I think in India, especially like Pooja pointed out, there is a severe problem of malnourishment, especially among dialysis patients, right? So while in the West, there are the foods that they eat make it less difficult, make it less easy to be malnourished than in India, where in India, very few, there are not, we don't eat a whole lot of meat and so on, right? So the problem in India is malnourishment. And typically what happens is the dietitians and doctors and so on, they impose a very brutal diet on dialysis patients, the result of which they don't eat, dialysis patients, they eat very little. There are things that they can eat actually, because honestly, malnourishment is worse than, maybe a higher potassium or a higher phosphorus, So with malnourishment, mortality is high, like Pooja pointed out. So I think the problem is the whole culture among healthcare workers to impose a very restrictive diet, because of which a lot of dialysis patients end up being malnourished. So I think we need to relax the diet restrictions a little bit, give them the broad guidelines, and then tell them that, you need to eat. Because what happens is as a result of all these restrictions is that dialysis patients, they don't eat at all. When you look at the food, the quantity of food people eat, it's extremely limited. And who can blame them, right? Salt free, potassium free, phosphorus free. The choice boils down to a very tasteless and a very boring diet, which nobody would like to be on. So as a result of that, nobody feels like eating good food. People don't feel like eating, at all. And that leads to a lot of problems related to malnourishment, like low albumin and so on. And I think Pooja has articulated that very well, that malnourishment is a huge problem among dialysis patients due to the severely restrictive diet that we are put on.
Yeah, that's true. So I remember even, so the food had to be leached and there were so many other restrictions, and literally I was wondering, what do I eat? There are not too many options left. And even though
the tricky part, Jaya, is that we are asked to eat a high protein diet. Yeah. Now, almost every single high protein food has either a high phosphorus or a high potassium. Where do we go? Like, what do we do? What's the solution? The thing is, people tell us you can't eat this and you can't eat that. And then they say you have to be on high protein, but give me options. What do you mean by saying high protein, but low phosphorus and low potassium? Give me options.
Yeah, absolutely. All right. So, Pooja, I'd like to bring you in now. Which are the most common 5 signs that one needs to look out for in identifying nutritional deficiencies? The idea is so the patients can sort of detect themselves, or the caregivers can detect this, and at least know that that there can be a primary detection level, so that they can thereafter, of course, go and consult the expert and follow it up. But many a times it just goes unnoticed until it reaches a much higher level. Pata nahi chalta. So how do we address this?
So I'll be sharing that, but before that, let me just let you all know that I have not put any restrictions in my presentation today. I've just put up what patients can eat and in what amount, because I remember on my first day of my BSc nutrition, my teacher, my professor asked me, what is the first thing you would restrict for a kidney patient? I said green vegetables, and she told me, dear, all vegetables are green. So, it becomes very difficult. As I said, it's a life that they are living, which is very inspiring. Let's go back to the question. Now, these are very simple signs, but what happens is, unfortunately, people don't associate it with malnutrition. Is my screen visible?
Yes.
Yes, Pooja.
And I'm not able to move my presentation.
Are you able to work it around now?
No.
Do you want to stop sharing and share it once again?
Yeah, now
Yeah.
it's working. So these are the most common 5 signs, and I actually wanted to put up a poll question where our, the ones who are attending could have, probably told us that what are the signs that they're actually facing. Now, the first thing that happens is there's unintentional weight loss. You're not trying to lose any weight, but each time, over a period of time, over 2 months, 3 months down the line, you'll realize that your dry body weight is sort of shifting down. And people are usually happy. Oh, my dry body weight has come down. Oh, is bar mera wazan kam hai. They're usually happy. They don't really think in a way that, why is it that I'm losing weight? I'm not trying to lose any weight. I have not done anything actively to, bring down my weight. Why is my weight coming down? Then loss of appetite. So I was able to eat around 2 chapatis, a cup full of dal, some sabzi initially. Now I eat 1.5 chapati. So that 2 to 1.5 happens over a period of time, which goes unrealized. It is also not realized that 2 chapatis comes down to 1 or sometimes even half. You just don't feel hungry. And people don't really associate it with nutritional deficiency. They feel, maybe mera BP high hai, or maybe, they have done something different with the dialysis, or maybe whatever I ate yesterday is making my stomach upset and I'm not able to eat. So you don't relate it with nutrition. Reduced physical capacity or functional status. So earlier I used to able to walk down in my campus for a couple of hours, sit with people. Now I can't do it. Maybe, I'm aging. अभी तो आई एम 40 प्लस, ऐसा तो होता ही है, आजकल के खाने में कहाँ कुछ ताकत आती है. So it's not like that. You have to realize these small signs and think that, am I getting weaker? Is this weakness that probably needs to be addressed? Second is, other one is loss of subcutaneous fat, which we are going to discuss in detail today, and loss of lean body mass or muscle mass. These signs, flow in very subtly, and mind you, if these are ignored, you don't address these signs on time, then over a period of time, it will probably, settle down as a weakness that will take a very long time to reverse. And dialysis process, the whole process is something that, is sort of a trauma to the body. And if you keep getting weaker and weaker, each time to tolerate that trauma, your body will put in more and more force. So one way you're losing your body stores, and other way you have to fight, your body has to fight something every other day. So it's very important, if you're losing weight without any reason, if you're not able to eat, your intake has come down to less than 50% of usual, you've lost 5 to 10% of your dry body weight, you're not able to work as much, please consult a dietitian. This is definitely related to your nutritional status. It may be related to your clinical condition also, but it has to be related to your nutritional status. You need to realize these signs and talk to your dietitian.
All right. So there is a question which has come up. So are we going to address this now or later? So someone's asked as to how can we overcome malnutrition in senile or aged patients when they eat very less as movement is also little. Can you address that, Pooja?
So I'm going to talk in detail about the nutritional intake which dialysis patients need. If it is about, what happens is with particularly patients who are aged, their body also sort of their gut microbiota, their body starts requiring lesser amount of nutrition, and so does their appetite go down. But particularly with chronic kidney disease, what happens is you're on a same routine, same kind of diet, same kind of advice for years down the line. There has to be changes made. So you can't expect a person to keep eating the same thing over and over again. There has to be combinations of probably, vegetable and dals made together, cereals and vegetables made together, fruits and vegetables made together. If you expect a person to keep eating the same thing again and again, it becomes difficult. When it comes to quantity, if you're eating, if the person is able to eat very little, then there's something called as increasing nutrient density. For example, when you make a normal chapati, it gives you around 100 calories and 3 grams of protein. But in that same chapati, if you make combination of flours, the fiber content, the calorie content, and the protein content becomes better. If you knead that flour with dahi or milk, the protein content comes up. If the person is not able to eat normal curd, you can make, add in, if not salt, you can add in some spices and make a raita out of it. Or add in some vegetables or fruit and make sort of a smoothie out of it. So there has to be, if you expect them to keep eating the same thing again and again, A, it's difficult. B, if they are eating one portion, make sure you're adding 2-3 food groups to it. So sort of making a pot meal is a better idea.
Okay, thanks, Pooja. Okay, so in continuation with the previous one, what are the common signs of muscle loss that can be detected through self-examination?
Yeah, so from here on, it is going to get a little technical. I would request all my audiences to follow what I'm doing, to examine themselves the way it is, being shown on the screen. And if required, you can even take screenshots and, just repeat it with yourself later on. It's not that technical, but, it's something new. So let's get started with how you can really detect muscle loss. Yeah. So for muscle loss, there are 5 sites which we examine. The first is temporalis. So these are sides of this is your forehead. These are sides. Over here, there are muscles. So if you masticate, when you chew your food, you can feel the movement over here. So this is when you masticate, when you use your jaw, you can feel the movement over here. We will examine these muscles and see. Then there is collarbone over here. Okay, this is the second side. Then when you make an OK sign over here, there is interosseous muscle. This we will see how it reflects nutritional status. When you hold a ball, make a cup in your hand, this is tenor muscle. Okay, we will see how it reflects. And then there are signs in your thigh muscle, knee muscle, and calf muscles, which show sort of nutritional deficiency. Okay, so for identifying muscle loss, these are 5 sites. We will go through this one by one. Number 1 is temporal. So you have to ideally make the patient stand. All of you can sit comfortably and do it, no problem. And examine if this region over here is normal, it has sort of a slight bulge, or do you have scooping or hollowing over here? When you touch here, वहाँ पे normal bulge surface है या आपको कुछ hollow लग रहा है? I'll show you a picture which will make it more clear over here. Do you have sort of scooping or hollowing over here? If yes, this is a sign of muscle loss. If you see in picture A versus picture B. Picture B, there's a normal scoop, there's no scooping, there's a normal bulge of the muscle. Whereas in picture A, there is some amount of scooping or hollowing. So this is site number 1. I'll repeat myself. Y'all can take down screenshots. Y'all can, note it down, do it later. It is a little technical, but if you have these signs present, please see a dietitian and get your muscle loss, corrected, because if it keeps happening, the efficiency with which your body can tolerate dialysis gets affected. Number 2 is clavicle bone. This is our collarbone, which I had just spoken about. Now, what you have to do is, first of all, just look at yourself. Is your collarbone visible? Is it very, very prominent? आप ऐसे देखोगे तो वो बिल्कुल easily आपको collarbone दिख रहा है क्या? Number 1. Number 2, when you touch here, आपका finger यहाँ पे ऊपर and यहाँ से, is it able to, sort of slide in? वहां पे आपका फिंगर अंदर जा रहा है क्या? I'll show you picture. Over here, if you see, so in first picture, the collarbone is not even visible. But in the second picture, it's not only visible, the fingers can even slide in. If you have this sign, this is even more prominent of a muscle loss, and you definitely need protein intake and other micronutrients corrected in your diet to, well within time, correct this muscle loss. Now let's go to the third part. This is the interosseous muscle. It is okay if you're not able to remember, the names of these muscles. Just remember the size. Now, if you all make an okay sign like this, and then look at this part. This part. Is it normal, having a normal bulge, or are you having a depression over here? Yahan par. I'll show you the pictures. So look at this. If you have a slight bulge over here and you've been on dialysis for quite a few years, or if you are on dialysis, more than 2 times a week, then this is slightly expected. But if you have a deep sort of hollowing, like in picture 3, then this is significant muscle loss, and probably you're in a state where you might even need nutritional supplements and stuff to correct your malnutrition. So if you have temporalis, pectoralis, interosseous at whatever stage, these are 3 signs present, and you're in a situation, I don't want to sound scaring or something, but this is something which we called as a nutritional emergency, and you must need to see a qualified dietitian and get it corrected. Now let's come to the fourth one, the tenor muscle. You need to cup your hand like you're holding a ball. So when someone throws a ball, you catch a ball, make a cup. And if this muscle has normal bulge, it's a nice, firm, bulging muscle, then everything is normal. But if you have sort of a hollowing here, I'll show you the picture. So this is a normal tenor muscle. And if you have hollowing, it looks somewhat like this. Now, a lot of times we see our hands, we feel उसमें wrinkles आए, skin loose हो गया है. Maybe I am aging. इतना dialysis होता है मेरे हाथ में, तो ये तो normal है. I have a fistula. No, this is not normal. And this is nothing related to the number of dialysis, nothing related to your age. It may be related to age, but please get yourself examined. It's very important. Lastly, your thigh, knee, and calf muscles. Now, this is a little tricky because in young people, the thigh muscles and everything are very, very firm. And in athletes, it is even more different. But if you're non-athletic, you're in the middle age or so, the picture 1 is normal. So you should have a nice firm rounding around the knee, thigh muscle. If you have a slight bulging patella, so patella is your knee bone. If it is bulging slightly, then probably you have mild to moderate malnutrition. But if the patella is very, very prominent, you're lying down, you're sitting, you're walking, your patella is standing right there, it's out of its shape, then definitely this is a sign of severe malnutrition. And if you have, I'll repeat myself, take the screenshots, do the exam on yourself. If you have 3 out of these 5 signs, you do need nutritional, revisions. And I went to the Nephroplus website. They've got a wonderful team of dietitians. If you are a Nephroplus guest, please reach out to your dietitians, talk to them. Don't talk to your dadi, nani, relatives, padosi. They will give you a lot of advice. but I'm not sure how much it will benefit. Do see a qualified dietitian if you have 3 out of these 5 signs. And this was about, detecting muscle loss. Now, what happens is these signs will tell you, okay, you have a muscle loss. How much at what site, in what, pattern is what is something only a dietitian can tell you. These are signs so that you know there is a problem. How bad is the problem? What is the treatment you need? Is what is something only a dietitian can help you out. So don't just sit back and think, okay, tomorrow I'll eat 2 eggs extra. मैं कल से ही sprouts खाना शुरू कर देता हूँ. That doesn't work out. You need a formal consultation. You need a formal advice. Thank you.
Wow, Pooja. Never looked at it from this point of view. Kamal, your views?
I think this is extremely useful, and while it is slightly difficult, I think if these luckily Pooja has allowed everybody to take screenshots, so I hope people have taken, and maybe later this presentation is already available on Facebook. So I think we would need to go back to this time and again to see and compare those 5 signs to see if we are malnourished. And I found myself checking, as Pooja was speaking, whether I'm malnourished.
Me too.
The amount of food that I eat, I don't think I'm malnourished at all. But no, but I think this was extremely useful, something very new that honestly, I don't think many people know. I think very few people would even have heard of such a thing. So I think that was very, very useful. Thank you so much, Pooja.
So this was the shark on the other side that I was talking about.
Okay, so Kamal, I wanted to ask you the next question. So if you could talk about the common experiences that someone on dialysis faces in terms of long-term protein deficiencies in dialysis patients.
Yeah, so protein is, I think, one of the biggest problems, and it starts off with this whole pre-dialysis when people are on CKD 1, 2, 3, 4, 5 before they reach ESKD. They are put on a protein restricted diet because of the protein, the load on the kidney and so on. But people kind of don't get over that hangover of low protein, and sometimes doctors, we are a nation of very few nephrologists, so doctors do not have that much time to, sometimes doctors miss it as well, that you need to, forget about restricted, you need to go bonkers on the protein, right? Because dialysis patients typically need 1 to 1.2 grams per kg of body weight of protein every day, and it's very difficult to get that kind of protein with the kind of food that we eat. So that starts off like that, and then many people, they are not able to adjust to the new protein regimen, and I guess it's very difficult from there on to actually adjust to a completely high protein. And Indian diet, by the very nature of the kind of food we eat, is generally low in protein, right? So there are very few non-vegetarians, and even the non-vegetarians don't eat a whole, compared to the West, the protein intake by definition is extremely low, and people find it very difficult to get that kind of protein in their regular meals, and they have to rely on protein supplements. And protein supplements, that you can't have a whole lot, because they don't taste that good. The protein supplements that at least I have tried, they don't taste very good. And then how much can you have, right? The problem again is with protein supplements is the water, the fluid. So you have to take it with water or milk, and then again that adds to the fluid restriction. So and then again there is the issue of protein loss during the dialysis session, more so during PD than in hemo, but there is a good amount of protein that's lost in both the therapies. PD, of course, it's crazy. So PD patients need to be extremely mindful of the amount of protein they're having. So it's a huge challenge to keep up with the protein requirement, on dialysis, especially in India.
Yeah, thanks, Kamal. Very true. Okay, Pooja, now let's move on to fat loss topic. So what are the common signs of fat loss that can be detected through self-examination? Can you please share?
So I'm sure all our listeners and the ones who are watching us have got a gist of how we are going to be conducting these signs. Now, moving forward, let's look at how you know that you've got subcutaneous fat loss. And mind you, any kind of unrequired fat loss is also not good. A lot of times people are happy, oh, fat loss, very good. Fats are not always bad. Your body needs it. In fact, it needs it in a diet percentage, if you need around 15 to 20% protein, you need around 25 to 30% fat. It's very, very important. So fat loss, don't be happy. It is something, which your body requires, and it should be there in normal amounts. Now, identifying fat loss, these are the three sites. We look at your orbital. So you typically have to see down your eyes and above your eyelids. I'll show you how to examine that. These are buccals. There are buccal fat pads. Now, a lot of times, buccal fat pads, people are intentionally getting it removed for getting that pouty look on your face, but it doesn't work the same way when it comes to malnutrition. If you got buccal fat pad loss, that really is a stage 2 fat loss, and you should be worried about it. And the last is your triceps. Let's take a look how you actually perform this kind of examination. So these are orbital fat pads. Now, when you touch down your eyes over here, do you feel a normal bulge? Is it firm or is it slightly hollow? Or you're sleeping well, you don't have stress, and you've got unexplained dark circles. So is it hollow or is it got a nice and firm bulge? Then you close your eyes and touch around your these bones just below your eyebrows. Are they very, very prominent? Does your eye look like it's sort of in a hollow cavity? If it does, then probably you've got stage 1 to 2 subcutaneous fat loss, and this is how it is. So when you have normal subcutaneous fat, your eyes will have a nice and firm bulge. The eye bone, the orbital bone will not be that prominent. If you got mild to moderate, there'll be slight, sort of depression, some slight dark circles. If it is severe, your eyes will look like as if it is in a hollow cavity. So this is number first site where we examine subcutaneous fat loss, and this is how it is. Let's move to the second one. Now this is buccal fat pad. If we touch around, the side part. So this is your jaw. You have to touch here in the center, above your jaw. So if you've got nice firm, this thing, if your cheeks have a little plump, if these are nice firm muscles and fat pads that you can feel fine. But if you got something like this or something even like this, so picture 2 is mild to moderate subcutaneous fat loss, and picture 3 is severe subcutaneous fat loss. So a lot of times we think is मुंह पहले से पतला हो गया है, कोई बात नहीं, अच्छा है मुंह तो आजकल, it looks good when you pout, it looks good when you're taking pictures, fat जा रहा है, I'm getting fitter. Maybe not. As I said, your body needs fat. Don't relate it with aging. A lot of times we feel maybe because we are aging, skin loose ho raha hai, and we give a lot of reasons to ourselves. It may be related to your nutritional status. So if you feel that this upper jaw part of your face is sort of losing the normal fat bulge, then probably you have a subcutaneous fat loss at stage 2. Now, this one is a little tricky, but I'll still try and explain. If you look at my screen, you have to keep your arm at 90 degrees. So which means this should be straight. Keep it at 90 degrees and now try to pinch. When you pinch, slowly you will feel that there is a muscle layer, and then you've got to only, move out to that muscle layer, come down and hold only your skin. If your skin has a very little pinch, means you have got a very thin subcutaneous layer of fat. Okay, if it is sort of fairly thick layer, then maybe you're fine. So if you're pinching your skin like this, very, very thin, then you've got a significant subcutaneous fat loss. And at this stage, you need a lot of corrections in your diet, because when you're having a subcutaneous fat loss, you will have fatty acid deficiencies, essential fatty acid deficiencies, which are important for your hormonal control and many other functions in the body. Along with that, you may also have fat-soluble vitamins, vitamin A, vitamin D, vitamin E, K. These all may be deficient. While vitamin D deficiency is a lot talked about, and your physicians may also give you vitamin D supplements on and off, vitamin E, A, and K are often ignored. when it comes to deficiencies. So if you're at this stage, if you got a very little skin holding when you do this tricep exam, apart from your, modifying fat intake in your diet, you may need corrections in your fatty acid intake as well as your fat soluble vitamin intake. So if you, even when you've got one of these three sides suggesting a fat loss, probably you need to formally see your dietitian. Thank you.
Okay. So, Pooja, there are a few questions which have come in. Renu wants to know whether someone with extra weight can also still be malnourished.
Definitely. So this is altogether a different, paradigm which we are facing when it comes to malnutrition. That people, and this is particularly high in South Asian countries. Why it happens is because people are obese, they are overweight, but there is more fat percentage in their body than the muscle. Okay, I'll try to simplify it. The concept is called as a thin fat Indian. So when you say you see a 50 kg person from any Western country versus a 50 kg person over here in any South Asian region, we've got more fat percentage. Okay, there's something also called as sarcopenic obesity. The term means when you are obese, you are high in body weight, but you will have very less muscle mass. And that is even more worrisome because you don't think that, you may be malnourished. If your weight is high, if you're overweight, obese, people feel, "Arey, hame to koi kuposhan nahi hai." Malnutrition, the Hindi translation straight away is kuposhan. And when you hear this word in your mind, you will have a picture of very thin fellow who's very frail, who's very weak.
Exactly.
But the flip side of it, malnutrition is also overnutrition. So when you're overweight, obese, particularly in chronic kidney disease, you need a formal assessment because you need to know with your weight being high, how much of it is fluid, how much fluid accumulation you have, what is the status of your edema and inflammation, and then what is the status of your overweight, obesity, muscle, and so on and so forth. So definitely, even when you're overweight, obese, you may have muscle mass losses, but you need to get that checked.
All right. Thanks, Pooja. Okay, so someone's asked how to take care of micronutrients. So that also takes me to the next question. So what is the most adaptable nutritional care plan when diagnosed with nutritional deficiencies? I think this will also answer the question.
Yeah. So I'm going to share my screen again. And as I had promised at the start of this discussion, I will not talk about what to restrict. I've just put up healthy food choices that you can make. But, this is quite elaborate. It needs a lot of individualized, planning when you talk about nutrition care plan, but we'll try to make it simpler over here. So now we've come to a juncture where you all have identified nutritional deficiencies. What to do next? Please see a dietitian. Only a dietitian, not your dadi, nani, neighbor, chacha, or anyone else, with due respect, can help you. Please see a dietitian and make sure you're seeing a qualified dietitian. Unfortunately, we do not have very stringent norms in our country where, only a qualified dietitian can practice. So you need to check that your dietitian has qualifications, she's a registered dietitian, and then you go for a formal consultation. Whatever we discussed are simple signs that you have a nutritional deficiency, but only a dietitian can tell you the magnitude of that deficiency and how to address it. The longer you take, the more you wait for seeing a dietitian, for getting your nutrition corrected, the longer it will take for your nutritional deficiencies to reverse. जितना ज़्यादा weakness है, आपको normalize करने में उतना ज़्यादा time लगेगा. So this is probably one of the most important take-home messages. Now, eating well with chronic kidney disease is very, very difficult because it is not something you will have for 1 month, 1 year. It will be there until you're fortunate enough to get a transplant. And after that, also the nutrition part of it doesn't really settle down completely. You have to be on certain diet restrictions and you have to follow certain norms even after transplant, but things get a little easier. We'll talk about few important things. I'm sure chronic kidney disease patients hear about this day in, day out. I'm not going to say something different, but I'll promise that I'll make it simpler. Y'all will be able to, know about options to eat rather than options to restrict. We'll talk about healthy protein. We'll see how whole grains can accommodate vitamins and minerals. We'll talk about potassium, phosphate, sodium, definitely, and fluids also, a little bit. Now, protein, how much and which one? So Mr. Shah had just mentioned that, when you're not on dialysis, you're told to restrict protein. Definitely, you need to restrict protein, but you don't have to stop taking protein completely. अगर आपको chronic kidney disease है, आपका dialysis नहीं हो रहा है, that doesn't mean you can't eat dal, milk, curd, and if you're a non-vegetarian, you cannot eat egg and non-veg. You can eat, but there is a certain quantity restriction. So आप कितना खा सकते हो, that you need to know. For example, अगर मुझे high blood pressure है, so I have to take high blood pressure medication. But कितना लेना है, that a doctor tells me. Okay, so this goes the same. If you're from stage 1 to stage 4, roughly on an average, you can take 0.8 gram protein per kg dry body weight. That still amounts to 48 grams अगर आपका dry body weight 60 kgs के आसपास है. And 48 grams, mind you, एक healthy adult भी इंडिया में नहीं खाता. We are all traditionally on low protein diets for some reason. Our staple foods are all cereals. Even if you talk about a healthy individual, 48 gram protein per day, very rarely people eat. 48 grams, you can easily accommodate a cup of dal, a cup of milk, a cup of curd, maybe 1 or 2 eggs. You can easily accommodate that. Okay, we will also talk about how much protein is there in these protein sources so that it makes it easier. If you're on dialysis, then you need to take 1.2 to 1.5 gram protein per kg dry body weight, depending upon your nutritional status, which comes to 72 to 90 grams अगर आपका वजन 60 kg के आसपास है. Here I'm just giving an example. आपका dry body weight कितना है, आप उसके हिसाब से multiply करेंगे तो you will get your value. This is just an example. Please don't get confused. Okay. Now let's see what are the sources. Abhi, time and again, you know about these sources. How am I simplifying it? I'm simplifying it by telling you how much protein you need. So अगर आप dialysis पे हो, आपका dry body weight कितना है, उसको 1.2 से आप multiply कर लीजिए. कितना protein daily चाहिए, आपको पता चल जाएगा. If you're able to follow me in the comments, you start calculating your protein requirement and put it. We will also get to know कि हमारा message आपको clearly मिल गया है. Okay, so number 1 is calculating and knowing how much protein you need. Number 2, you need to know which source has how much protein. Now, all these values are 100 grams. 100 ग्राम beef में 19 to 20 grams होता है. 100 ग्राम dairy products, I've written about milk and curd is around 3 grams. अगर आप soy ले रहे हैं, so around 100 gram has 12 to 16 grams. Sometimes it's even more if you're taking certain other soy products. You talk about tofu, you talk about legumes. यहाँ पे egg का protein is 1 egg, which is close to 50 grams. Okay. तो अब आपको ए पता चल गया कि पूरे दिन में कितना प्रोटीन चाहिए, एंड प्लीज फील फ्री टू टेक अ स्क्रीनशॉट हियर सो दैट यू नो कि किस फूड में कितना प्रोटीन होता है. अब आप मैथ्स लगा लो. अगर आपको 60 ग्राम प्रोटीन चाहिए पूरे दिन में, आप उसका अराउंड 70% इसमें से लीजिए, बिकॉज 30% प्रोटीन आपके अनाज से भी आता है. ओके, तो अगर 60 ग्राम आपका प्रोटीन रिक्वायरमेंट है डेली का, 60 minus 18, around 42 grams प्रोटीन आप इन सारे सोर्सेज में से ले सकते हो. बचा हुआ 18 grams रफली आपके सीरियल्स में से, रोटी, ज्वार, बाजरा, राइस, आपने जो भी खाया उसमें से you get. If you are able to understand this, please write it in the comment section. This is the most important message we are trying to give. I am not telling you ABC has high phosphate, even though it is high in protein, you don't eat. Okay, आपको potassium, phosphate, sodium restriction की जरूरत है, but not at the cost of protein. If your protein intake is less, you lose muscle mass. We will not gain much benefit by keeping your laboratory data in place. It's not of much, clinically when you compare the two, you need adequate protein, adequate muscle mass, and then a normal laboratory value. Now, a lot of doctors will stop sending their patients to me, but this is what it is. And this is how I practice. Okay. So do let us know in the comments that you're able to follow this particular calculation that we did talk about. Now let us move to potassium.
One question I
Yes.
had, just go back to the previous slide.
Yeah.
The pulses and legumes that you mentioned, lentils, chickpeas, that is the cooked thing has 18 to 24 or the raw?
Okay, so this is raw and this is per 100 grams. Now one portion of dal, lentils or any this thing is roughly 30 grams. जो एक कटोरी दाल ये वगैरह बन के तैयार होती है, तो आपको कच्चा 30 ग्राम लेना है, that is one portion, and जो value यहाँ लिखा है that is of 100 grams. So yeah, this is a good question because raw versus cooked may we often get confused. You should always calculate your protein based on the raw weight that you're taking. Thank you for the question. So let's talk about potassium. Now I've put all the sources over here, which are good choices for potassium. Okay, y'all are again free to take a screenshot. All this, you can eat 2 portions per day. It has less than 200 milligram potassium per 100 gram. Okay, आप easily ले सकते हैं. Now I'm not saying आप दिन में 2 एप्पल खा सकते हो, साथ में 2 ब्रोकली भी खा सकते हो, साथ में 2 कैरेट भी खा सकते हो. नहीं, इनमें से सब में से any 2 you can take every day. Okay. Now what happens is, जी mango season है. I am not diabetic, but I am a kidney patient and I love mango. It's okay. The day you're taking mango, you need to bring down your portion size. अगर आप एक पूरा मीडियम साइज का एप्पल खा सकते हो, तो आप मैंगो का एक सिंगल स्लाइस भी खा सकते हो. Preferably you take it before 3 to 4 hours you're going for dialysis, so that dialysis will take care of it, even if your potassium shoots up. अच्छा, डायलिसिस के पहले आप हाई पोटेशियम कुछ खा लो, इसका मतलब ये नहीं है कि घर से निकल रहे उस समय खा के निकले. Your body takes time to digest and for that potassium to be available in your bloodstream. So if you are fond of mangoes and you have a dialysis early morning, you can eat 1 slice a day prior in the night. And even if potassium intake thoda बढ़ रहा है, next day dialysis will take care of it. Okay, if you have an afternoon dialysis session, then you take 1 slice with your breakfast or maybe as an in-between snack. Give it 2 to 4 hours gap, because अभी mango खाया और dialysis में potassium निकल जाएगा, that doesn't happen. Your body takes time. Give it a gap, and again, a lot of doctors will stop sending their patients to me because what I'm saying is generally, not believed. But as I said, we got to break the, traditional thinking of restricting things and making the diet a task for these patients, because they are following it day in, day out. They have to be with this kind of eating for years together. And it's food, it's not medicine, it's not a pill that you can simply pop up and be okay. Come on, everyone gets cravings, you've got likings. So this is just to ease out. अगर आपको ऐसा कुछ पसंद है जो पोटेशियम में हाई है and you have been restricted from taking that, then you need to reduce portion size. So अगर आप एक पूरा मीडियम एप्पल खा सकते हैं, as I said, मैंगो का आप सिर्फ एक स्लाइस ले सकते हैं. That if that helps and if that brings down the stress of being on a restrictive diet. These are some simple tips. Potassium on labeled and packaged foods, it's not always there. So if you have a query, talk to your dietitian or just check out whenever you're going for your dialysis. Wait before you consume. A lot of low salt, low sodium, salt substitutes, etc. are high in potassium. So you need to watch out. आप कम नमक use कीजिए rather than using kala, senda, pink, and I don't know what all colors are available these days. Now, it may be there's a trick. If you look at the nutrition label of a low sodium salt, okay, versus nutrition label of a normal salt, हमारा बिचारा टाटा नमक and the very fancy, green packet wala Tata Light, there is a sodium difference of 5 milligram per 100 gram. Now, 5 milligrams is a fairly good amount. अच्छा difference है. But that difference is there for 100 ग्राम, 100 ग्राम पे. और आपको एक दिन में 3 से 4 ग्राम, मैक्सिमम 5 ग्राम नमक अलाउड है. अगर 100 ग्राम पे 5 मिलीग्राम है, 5 ग्राम पे कितना फर्क हुआ? It's hardly anything. So eat your normal salt, but eat less. हमारी जो टेस्ट बड्स होते हैं ना, जिस तरह का खाना हम खाते हैं उसके साथ धीरे धीरे it gets adapted. So slowly over a period of time you will get adapted. It's always safer than getting into, or falling for these fancy substitutes. We really do not know what they may contain when they are substituting, these natural contents. And if you're, as I said, कुछ high potassium बहुत पसंद है, you need to reduce the serving size, as we just discussed. Now let's talk about phosphates. Again, I have put up everything which are good choice of phosphates you can consume, and I'm not going to talk about restriction of phosphate. Let's talk about some important information. Again, phosphate, potassium, all these things are not very clearly always labeled, on packaged foods. Whenever you're consuming, you need to talk to your dietitian. In fact, most processed foods and most packaged foods are high in phosphate. So preferably go for your home-based, home-cooked meals. Again, I think this is not a big problem in India because we are anyways quite pro in preparing things at home and eating, and हमारे लिए package वाला खाना अभी भी अमरीकी है, so it should be okay. But then, there is also a class where people are working, they've got working hours, and we tend to buy raw. So for example, अगर आपको आज चिकन बनाना है तो आप चिकन पैकेट वाला ले लें. That packet wala chicken has been treated and may contain more phosphate, so you need to watch out. Then again, if you're on phosphate binders, these are medicines which your doctors may give you. तो ये नहीं सोच सकते कि okay, I am eating a phosphate binder, I don't need phosphate restriction. You do. आपका phosphate high है, इसीलिए आपको medicine दिया है. So while you're on phosphate binders, you need to be more worried about your phosphate intake. Lastly, we'll talk about sodium. Again, the primary source of sodium in your diet is your salt. All other things, whatever contains sodium naturally, is not, it does count, but it doesn't form the significant part of your dietary sodium. It's probably 10 to 20% of the sodium that you get naturally from foods. The most important takeaway message over here is when you're trying to restrict sodium and you feel taste is being compromised, don't, fresh herbs and spices are saviors. So traditionally, हमारे घर में, that jeera ka masala which is prepared, you prepare a lot of spices at home. Nowadays, herbs are available. All these you can use for adding that taste element in your diet. But again, you need to be cautious and read the label, at least the ingredient list, if there is added salt in it. Now, if there is, salt is not added, if there is black salt added. If not, then, a slightly liberal use of spices should be okay to add that taste value and, to let the food seem like food and not a punishment or part of your medicine. You can use this in your accompaniments, your homemade recipes to enhance the taste and have better intake. So some tips about sodium, I think I've already mentioned. One important thing is you need to check for hidden salt, which is there almost in everything that you're buying from market. So whatever has there's a chemical, then that adds to the salt intake. Okay, so salt is sodium chloride. If you are, and it's particularly sodium that we are trying to restrict when we are restricting salt in your diet. So see the label. If there are a lot of sodium based preservatives, then probably, you need to watch out. With this, I would like to conclude my side of sharing today.
Thanks
And I
so
hope
much,
it was
Pooja.
helpful.
Yeah, that was really insightful. Kamal, if I may ask you, how is nutrition being managed at Nephroplus?
No, I think the message that Pooja had read, we follow a very similar philosophy where we don't restrict, too much. We say that we say, you tell us what you want. We'll tell you how to fix your diet so that you can have what you want,
How wonderful.
including mangoes and stuff like that. So we don't restrict anything. And especially for those who are on thrice a week dialysis and are regular with their dialysis, for them, it's practically, they can eat what they want. Of course, like Pooja said, limited quantities, moderation is the key, but we believe that, it is very bad for the patient's outcomes if they start craving and get depressed. Many people, they crave some foods and then it's the blanket restriction that you can't have this. And then they go into depression, which is even worse for their outcomes, So we advise all our guests to have everything in moderation. And if you have some doubts, let us know. We will tell you how to work around it.
Wonderful.
Great.
So there is one more question which has come in. Bharat is a transplant recipient and he's asking how much protein can we have post-transplant?
So again, a lot depends upon your nutritional status, but at least for initial 6 to 8 weeks post-transplant, while your newly transplanted kidney is still accommodating, you need high protein. A minimum of 2 months, 8 weeks, you need at least 1.2 grams protein getting in. This is also because while you were on dialysis and while you were waiting for that transplant, a lot of muscle and protein loss has already happened. And this is the time when your body gets into anabolism and tries to recover that loss. So if you can, there's no harm if you're on a higher protein diet for a relatively longer period also. It is always better than taking lower protein. So at least for 6 to 8 weeks, maybe more, you should be taking 1.2 grams per kg per day.
Okay. Thank you so much. I think we'll conclude this session. This was really insightful. Pooja, thank you so much for taking your time out. Kamal, wonderful interaction there. Thank you, Nephroplus, for partnering us in this important educational initiative. Looking forward to working with Nephroplus together. Pooja, looking forward to working with you as well on more such initiatives. Thank you so much for taking your time out. I hope the audience enjoyed. Yeah, if there are any more queries, please feel free to post it on the chat box and I will pass them on to Pooja and I'll pass on the answers back to you all. Sorry, Pooja,
Sure.
you were saying something.
I was just wanting to thank you. It's always a wonderful experience to work with MOHAN Foundation, who have a purpose, such a noble purpose. It was great meeting Mr. Shah.
I would also like to add, Jaya, I think Nephroplus is very proud to be partnering with MOHAN Foundation, doing such fantastic work in the transplant space. So we are very thankful to you for making us be a part of this program, and we are very proud to be partnering with you on the other initiative on transplant awareness among the dialysis population. So we promise to continue to partner with you for the foreseeable future, and we are really happy to be partnering with you. Thank you so much.
Grateful to both of you. Thank you so much, Kamal, for those wonderful words. With that, we will conclude this session here. Take care. Good evening. Bye.
Thank you.